Ladies and gentlemen, thank you for joining Disparities in Cardiac Health. Your host for today is Melissa Ottinger and Tipfree King. Ms. Ottinger, Ms. King, you may begin.
Thank you. Good afternoon to all of our DASH participants. Today we're going to be discussing some new guidelines that were released in 2013. We're going to be discussing the guidelines that were published in November by the American Heart Association, the American College of Cardiology, and the Centers for Disease Control and Prevention. The guidelines discuss the importance of lifestyle modifications, evidence-based algorithms, and standardization of treatment. We are also going to briefly touch on the overlapping goals of other programs such as Million Hearts and the Michigan Health and Wellness 4x4 Plan, also provide some information on other relevant guidelines. So as you may have heard, on November 15th, the AHA, ACC, and CDC released a science advisory for the management and treatment of hypertension. This will be accomplished by using evidence-based algorithms and standardized treatment. Some facts about hypertension, the heart facts. 1 in 3 U.S. adults have hypertension. 36 million have uncontrolled hypertension. 40% or 14 million aren't even aware they have high blood pressure. 16 million are taking medication and are still uncontrolled. And maybe one of the most surprising statistics is that 26 million have been seen at least twice by a healthcare provider in the past year. These are patients with hypertension who are basically hiding in plain sight. 30 million do have insurance and 14 million are Medicare beneficiaries. So, as I said previously, there are some other programs and initiatives going on that all have the same goal, to create a healthier U.S. and to reduce our heart attack and stroke risk. So, as we know, the Million Hearts goal is to reduce heart attack and stroke by 1 million by 2017. The American Heart Association also has a goal to reduce the U.S. death rate from cardiovascular disease and stroke by 20%. And the Michigan Health and Wellness 4x4 Plan uses a lot of the same measures, maintaining a healthy diet, engaging in regular exercise, annual physicals, and avoiding tobacco use and exposure. And they also encourage patients to know your numbers, your BMI, your blood pressure, cholesterol level, and blood glucose level. Now, Tipfree is going to talk about things that you can discuss with your patients to lower your blood pressure.
Good afternoon, everyone. This slide here is an example of materials we provide to health fair participants. It shows how much your blood pressure will drop if you adopt the different lifestyle modifications listed. Weight reduction, we encourage participants to set a weight loss goal and to speak with their physician on what a healthy weight for them would be. The DASH eating plan, we provide them with the DASH diet eating plan at each event that we attend, and we ask them to discuss with their provider which diet would help them to reduce their weight. Sodium reduction. Sodium reduction is something that we teach all the time in our Heart Health 101 workshops, and at health fairs we also provide them with materials that discuss sodium reduction. We show them how to identify sodium or salt on nutrition labels. We give them examples of what nutrition labels look like. And we also provide them with sample packets of Mrs. Dash, which, as we all know, Mrs. Dash does not contain any sodium. So we really try to work with our health fair participants to encourage them to cook and reduce their sodium intake in their diet. Physical activity, as you see here on the chart, it says that the average drop in blood pressure from maintaining physical activity, regular activity, whether it's walking or biking or gardening even, at least 30 minutes per day on most days of the week, it says that your average drop in blood pressure would be 4 to 9 points. Moderation of alcohol consumption. This is something that we stress to our class participants, that even though we have heard that red wine is good for the heart everything in moderation. So we do encourage them to limit their amount of alcohol. There are several tools that can help your patients. Most of our patients and our health fair participants do have smartphones, and if not smartphones, they do have connection to the internet. Some of the tools would be the American Heart Association's Life Simple 7, American College of Cardiology's CardioSmarts Patient Education Portal, and the Million Heart Health Mobile. Simple 7 program is a health tracking system. It's patient-oriented, a clinical decision support tool, and it's oriented to individual patients. It tracks cardiovascular health performance measures, and it provides feedback on the data. The American College of Cardiology's CardioSmarts Patient Education Portal is a blood pressure management tool, an interactive workbook to educate and motivate the patients better in health, and a patient text messaging program, which provides heart-healthy tips aimed at primary prevention. The Million Hearts app informs users of their heart attack and stroke risk, as well as connects them to pharmacies that offer blood pressure and cholesterol screening. Here is a slide showing the home page for the My Life Check, Life Simple 7. As you see, they can chart their activity, their cholesterol control, their diet, manage their blood pressure, weight loss goals, reduce their blood sugar, and smoking cessation. The American College of Cardiology, their CardioSmarts Health app. This is just a snapshot which shows how patients can utilize the dashboard. They have a toolbox. They can set up their own challenges and goals, and there is a spot for medication to manage what medications they are under. And here we have the Million Heart Health mobile app. As you see here, patients can assess their risk for stroke and heart attack.
See, one thing on the Heart Health mobile app, it will also allow you to locate pharmacies in your area that are doing cholesterol and blood pressure screening. Here is the algorithm that was released by the AHA, ACC, and CDC. I apologize that it's so small. We are able to send this to anyone who would like to receive it. So I know that recently there has been some disagreement on this particular model, but we can still take lessons from this. It's important to choose a model or protocol that works for your practice and patient population, as well as understanding the importance of the role of patient engagement and self-management is to treating and controlling high blood pressure and lowering patients' risk for heart attack and stroke. This algorithm discusses when to have the patients come back in for rechecks, when to introduce secondary medications, and also how to discuss, or at what point in therapy to discuss lifestyle modifications such as diet and exercise. The Million Hearts website has a customizable protocol, so it encourages practices to get together the providers, medical assistants, front desk, to develop a protocol that works best for your practice. On the Million Hearts website, they also have examples of the Veterans Affairs Department of Defense protocol, the Kaiser Permanente Institute for Clinical Systems Improvement, and the New York City Health and Hospital Corporation. All of these institutes have protocols that they developed using evidence-based guidelines, and so it's important to look at these to see if there's a way that they can be incorporated into your practice. Also, we know that there is an algorithm for treatment of hypertension released by JNC 7. We are still awaiting JNC 8. Same idea here with in regards to when the patient should return for recheck, how to, or when in therapy to introduce second medication, and lifestyle modification. Some other guidelines, as you know, the Disparities in Cardiac Health program, we distributed hypertension change packages, which were vetted by Dr. John Flack from Wayne State University. He's a hypertension specialist, and he has a protocol for dual drug treatment in African Americans. That is available on the DASH website, or we are happy to send it out to you. There were also some new guidelines released from the National Heart, Lung, and Blood Institute, in addition to American Heart Association and American College of Cardiology, regarding management of obesity and cholesterol. Some of the changes include diet, reduction of calories from trans fat and saturated fat, following the DASH diet, fruit, vegetables, whole grain, low-fat dairy, reduction in sweets and red meat, lowering sodium intake, and the addition of physical activity to reduce LDL and non-HDL and blood pressure. Cholesterol, some changes for new guidelines, is moving away from specific LDL and non-HDL treatment targets, using appropriate statin therapy, and understanding the adverse effects of non-statin therapies. Risk assessment, using race and sex to determine the 10-year risk for cardiovascular disease. The BMI, some new guidelines, is more frequent height and weight measurements, waist circumference measurements, comparing the patient's BMI with their cardiovascular disease risk, and discussing the patient's need for changes to diet and activity, and also prescribing diet and activity to achieve desired weight loss. In addition to the advisory released by the AHA, ATC, and CDC, they also put out a call to action to provide healthcare professionals with evidence-based tools and system-wide standardization, bring together organizations to identify programs that are working locally, regionally, or nationally to improve blood pressure awareness, treatment, and control, which will improve other cardiovascular health factors and behaviors, and also engage patients and individuals in the process of controlling hypertension. That concludes our presentation for today. I do have a couple of announcements, and then we can take some questions. The DASH data for quarter 4 is due by January 15th, 2014. If you require technical assistance pulling reports, please email the DASH@mpro.org. Interventions are being rolled out to provider organizations and private offices. If you have not been contacted, please email the dash@mpro.org. And also for 2014, if there's a topic you are interested in learning about or presenting on, we welcome your input. If you could please contact me at mottinge@mpro.org with your ideas, and we would be happy to see if we can work them into our schedule. Also, the DASH team wanted to wish everyone a Merry Christmas and a Happy New Year. One last thing. Our January webinar will be on January 15th, and the American Heart Association will be joining us to discuss their check change control program. As I stated previously, we are able to send out all of our resources regarding today's webinar to any participant who would like it. Just email the dash@mpro.org, and we'll be happy to send that out. And now, operator, if you could please open the line for questions.
Ladies and gentlemen, if you'd like to ask a question, please press the number 1 key. We have no questions at this time.
Okay, I wanted to thank everybody for joining the call today. There should be a survey that will pop up before you. It's up there now. If you could please fill that out before you exit the call, we would greatly appreciate that. And thank you for your time.
Conference is now ended. You may now disconnect.